Listen to these statistics. Melanoma rates are increasing faster than nearly all other cancers. Melanoma is the most common cancer among women aged 25 to 32, and as many as 10,000 people a year die from melanoma. We will discuss melanoma and learn about a company that produces products that detect skin cancer early on a cellular level. Next on Hometown Talents and Treasures. Hello everyone, I'm Eszter Vajda and welcome to Hometown Talents and Treasures. Joining me is Deb Girard. She's the Executive Director of the Melanoma Foundation of New England, and Mike Hone is President and CEO at Caliber ID. Deb and Mike, thanks for coming on to talk about this very important subject. I've just mentioned some of those statistics. They're staggering, scary. Deb, this has become an epidemic in this country. How did we get here?
It is. It's a public health crisis. I think that we have underestimated the impact of ultraviolet radiation and being out in the sun, and the impact of tanning beds with young people and older people alike. And we begin to think about skin cancer as just a skin cancer. You can have it removed. It's not a big deal, except when it is. And I think that's what we're looking at with more diagnoses of melanoma.
And we talk about, you know, ages 25 to 32 women. Okay, a lot of them are tanning beds. But Mike, men over 50 are also susceptible.
I think one of the problems with skin cancer, of course, is that, you know, you talk about people over 50, you know, back in the day, you know, you put on baby oil, you were trying to get a suntan, you're doing all these crazy things.
It's a cool thing to do.
Exactly
be a tan.
Right. Yeah, you want to look healthy. And at the end of the day, a lot of times skin cancer doesn't show up for 10, 15, 20 years. So that's why it's really beginning, and you have that baby boomer generation now that's hitting those numbers, and all of a sudden it's popping up.
Outdoor workers, people in the armed services in desert-like climates, where
golfers who, you know, men just out there without a hat. You said something interesting, that it lays dormant for 10 years. So you could have some kind of a mole and it be benign, or how does that work?
Well, it can be dormant. Many times it is, and it doesn't show up for a number of years because, you know, typically with skin cancers, they start at the dermis-epidermis junction and will come up until it turns into something bad, and then it begins to go down. And that's when it gets bad. So early detection, go to your dermatologist, go to your physician, and early screening, early detection, like all cancers.
So why aren't, Deb, people going, you know, you have this campaign right now, the annoying mole.
Our annoying mole,
and we
get
all
it checked.
have this little something, this annoying little mole, and we just don't think twice about it. It's so small, it doesn't hurt.
Well, and I think that's part of it. Part of it is increasing the awareness about anytime you see your healthcare professional, ask them to look at your skin, whether that's your primary care physician or your dermatologist. Realistically, only about 15% of the population actually sees a dermatologist. And it's important that as you do other screenings, other self-checks, that you look at your skin for anything that's new or evolving.
What's been really scary for me, you know, in the past year since I met our friend Kevin Belanger, who ran the Boston Marathon again for his sister Denise, and I should mention that you guys just had a great run at the Boston Marathon, raised over $403,000 to raise awareness for melanoma. But since I met Kevin, there's been two people that have been affected in my life directly by melanoma. My sister, one of them, that goes to a dermatologist on a regular basis, and they found a few moles, questionable skin areas, but they missed some of them. So she did due diligence. She went to the doctor. They missed it. So why? So what now?
I think it happens, and we hear these kind of stories a lot. And there are some people for whom they never find a primary site, that they have metastatic melanoma, and they don't find the site that it occurred in. But diligence, you know, vigilance, regular vigilance is important in this area, because really melanoma is the only cancer that when caught early is almost always curable. Think about that.
Wow.
No other cancer can say that, and it really makes the case for prevention and early detection.
Now, the interesting thing about one of the areas that was a malignant melanoma for my sister, it was under her arm. So it doesn't have to be, you know, exposed to the sun. How does that happen?
Well, it's just, as you said, as Deb said, it can grow from almost any place. It doesn't have to be where the sun shines. That's what's always interesting. It can be under the nail beds. It can be under in the bottom of your feet. It doesn't have to be. It can be on your back that's never exposed to the skin, or under your hair. It's just amazing how quickly it can happen. And you know, I've had 3 friends die of melanoma in the last 4 years now.
Wow.
And it's just, it starts. They missed a mole on a guy's back, and 6 months later he was gone. You know, and his daughter was chief of oncology at UNC in down in the Carolinas, and he was getting checked every 90 days, and they still missed it. It's not a perfect science.
We like to say about 1/3 of melanomas are caused by your genes, another 1/3 is caused by UV, and then another 1/3 is a combination of both UV and genetics. So ultraviolet radiation plays a large part, but so does your gene pool.
Yeah, so for me, having my sister, I'm already marking the calendar of having to go. The other thing is the tanning beds, and several states are working on legislation. Deb, I know you've worked on legislation.
We have. We've worked on a lot of legislation. This is a very important issue to try to ban tanning bed use to minors. We don't let our kids go to the local pharmacy and buy cigarettes, but we let them go to a tanning bed. We know that on any given day, 1 to 2 million teenagers are going to tanning beds. And we also know that even one visit to a tanning salon can increase your risk of melanoma by 20%, and it just goes up from there. We know that teenage girls use tanning beds more than teenage boys. And at this particular time of the year, during prom season,
we're coming up to the summer, and pale is not cool.
Pale is getting cooler, though.
It's cool in Asian countries and other countries.
Absolutely right. Absolutely. You think about very low incidence of, and it's probably part of the gene pool, but very low incidence of skin cancers in the Asian countries, Korea, Japan, China. Very, very little. And but you look, big hats, umbrellas, long sleeves.
Yeah.
You know, it's pretty interesting. You know, how they take care of themselves, and fair skin, very fair skin.
So the legislation trying
to move this forward. It's extraordinarily challenging. This is a very big business. The Indoor Tanning Association is a $5 billion a year business, and while they say young teens make a very small percentage of our business, it still doesn't stop them from trying to get in the way of legislation. So we have successfly, in the New England states, gotten legislation in Vermont and in Rhode Island and Connecticut. We've been trying for years to get legislation passed in Massachusetts, and we actually got some legislation passed in Maine, and then the governor vetoed it. So there's still a lot of work to do around the country, and the tanning bed legislation, the tanning bed lobby is very strong, and they really want people to believe that tanning beds are safe, and they just are not safe.
Mike, Caliber ID, the Viva Scope, you have several products out there. Fascinating. Detecting on a cellular level, one visit, and it detects it. How does it work?
So the technology is technology we've been working on for almost 20 years. A lot of the core technology came out of MGH, as a matter of fact, back in the early 90s. And we've continued to develop, and we feel it's finally ready for prime time. What it basically does, it's reflectance confocal microscopy. We use a very low-powered laser as a light source to look through the tissue, through the skin, down to the dermis-epidermis junction, to look at the individual cells and let the doctor, we don't make the determination, we basically provide an image that doctor can then make a determination from. They can make the diagnosis from that image. You know, just like they do today. Today they take a biopsy, they send it to a path lab, pathologist will section it, freeze it, stain it, look under a microscope, and make that determination.
But instead of chopping it off first,
yeah, we can look at it kind of real time and send that image if that's not if that dermatologist, for example, is not a dermatopathologist. We can send that image via a HIPAA-compliant secure network to a derm path or a pathologist who can then look at it and make the determination right then, virtually real time.
And this is now in several countries.
Yeah, we have the devices. We have about 500 of them out around the world. Only about 150 are in clinicians' hands. The bulk of them are in researchers' hands. Places like Procter & Gamble and Schick, Gillette, L'Oreal, Chanel, anybody that's putting something on the skin uses our device to make sure that it's not either hurting or it's actually doing what they say that it's going to do. We're just now moving to the clinical side of the business, and we have devices at every major institution around the country, whether it's Memorial Sloan Kettering, Johns Hopkins, the Mayo Clinics, University of Miami, all use this device as a clinical diagnostic tool. We're just now moving into, we're starting skin cancer screening centers across the country.
First one in California.
First one on.
How's that going to work?
The first one's going to be on Wilshire Boulevard in Beverly Hills. We'll be advertising. It'll be all out of pocket. If you have a lesion you're concerned about, you can call, make an appointment, and come in and have a look at instantly. That we'll have treatment teams around the zip codes basically, and when if the patient has a problem, they'll send them to a treatment to a dermatologist or a surgeon to have it removed. But they'll be able to know in hours whether or not that lesion is cancer or not. If it's not, go have a nice day. You can come back again in a year or 6 months. Yeah, but because we can give that, we don't give the diagnosis, but because we can give that image. Imagine a CT image is really what we're doing. I mean, think about this. If you had a stomach ache today and it went on for days, and you went to your doctor and said, "Geez, I really have this stomach ache, and I don't know what's going on." And they said, "Well, you know what? We'll schedule for surgery and do a little exploratory surgery and see what's going on." You'd run to the hills as fast as you can. You'd say, "Well, what about an MRI or an X-ray or a PET CT or a CT scan? What about that?" Well, okay. And basically, when you think about the way it's practiced today, these doctors, thank God, they're as good as they are. They're very good at basically pattern recognition. They're looking at these lesions, these moles, these pink lesions, and saying that it's evolving, it's changing, it's this, it's that. So that's one that's suspect for some sort of skin cancer, whether it's basal cell or a squamous cell or whatever. And we're going to do a biopsy and have that checked out. Same sort of thing. In our case, we can just basically take an image of that and give you an answer very quickly.
California is the first one. Where next?
Probably Philadelphia. We're getting ready to schedule one. We're working with Brigham and Women's here in town to put in probably the first one in this area. And then University of Miami, Memorial Sloan Kettering is building a whole new facility in New York, New Jersey, and Long Island, and they're going to put in 7 new systems there in the fall for exactly this. Dr. Alan Halpern, who's chief of dermatology at Memorial, is putting this whole new center in. It's going to be pretty interesting.
And so there's a Vivascope 1500, different numbers, 3,000, 2,500, and so forth. How are they different?
So the thing that's really kind of stepping things up is this new handheld device that we introduced just about a year ago now, because now you can surf across that lesion very quickly. It's non-invasive, so if it's on the face, on the arms, on the chest area, it's very, very quick. And we can train a technician to do the imaging, so you don't have to be a doctor to do the imaging. Think about ultrasound, think about an X-ray. Those are not doctors doing it. You have doctors interpreting the imaging. We don't want somebody guessing at what's going on there, because that's the real key. When you think about it, it's the pathologist that's making the determination. It's not the dermatologist that's making the determination. They're sending that lesion, that piece of skin, that tissue out for a pathologist to look at. And that's who makes the determination for the dermatologist or the primary care physician, whoever did the biopsy. And one of the issues in this country, when you think about it, there are about 14, 15 million biopsies done a year, and of those, somewhere between 60 and 80% are benign. So if you can eliminate those benign biopsies, and that's our challenge, that's our goal, because it saves the healthcare system a tremendous amount of money. We have a young lady that works for us that's 24 years old that's had 17 biopsies and never has one been.
Wow.
Never has one been.
But the scars are there.
The scars are there. So if you can do that, it's a huge, better care for the patient, better for the system, for the healthcare system, and you can detect it earlier, and you can look at a lot of them very quickly. So you don't have to, cut off a bunch to find out. If you need to surf across, 3 of them, 10 of them,
This
whatever
is
it is.
incredible technology. It
It
started
is.
in New York.
It actually started, well, the companies, our engineering and manufacturing are all and development are all in Rochester, New York, kind of the imaging capital of the world, really, when you think about the Bausch and Lombs, the Kodaks, the Xerox of the, back in the day. The Institute of Optics at the University of Rochester is there. So you have a lot of very talented people in that area that really understand imaging types of technologies. So, well, but when you look at the where we're going to have the first one at, the core technology was really invented in 1957, and then it developed a lot. I mean, Rox Anderson, Milner Rajak Shah, Salvador Gonzalez were a group at MGH that really took it to another level, and then we purchased all that technology, licensed it out of MGH, and then began to expand on that in about the 94, 95 time frame, and then have taken it from there. But it's a long haul. Breaking into the medical field is not a, I always jokingly say you could have the cure for cancer, and if somebody's not getting paid for it, it doesn't matter. That's probably not exactly true, but it's more true than you like to think about.
The truth. Deb, what does a product like this mean for this epidemic?
Well, I think as we started to talk a little while ago, if prevention and early detection are going to be the key to reducing the risk of melanoma, then realistically what we need to be looking at is how do we screen large numbers of people. Yeah. I would say, something like a national screening project. There's one a project in Germany that's going on.
Wow.
But really looking at, is there a difference if we are screening large numbers of people over time? Are we going to reduce the risk of melanoma and non-melanemic skin cancers?
Yeah, and that German thing is important. We are actually, our device is listed as a standard of care for both melanoma and basal cell carcinoma in Germany, and our doctors are being reimbursed for it there, and we're rolling it out, very quickly over there. But getting it here is another thing. But I think the statistics are going to show that early screening, early detection is what it's all about. I think Deb's 100% right.
Alongside with that, you can go to the dermatologist, you can self-test, but you have a very interesting program going on in conjunction with Supercuts, the Skinny on Skin, where you're encouraging hairdressers to
We
look
started
for
this
that.
project about a year ago, and it came from a young medical resident whose mother was diagnosed with melanoma because her hairstylist in Houston found a lesion on her scalp. And she came to us and we put this program together where we started training hairstylists to look for abnormal lesions in the head and scalp, not to diagnose, but really to be the eyes in the back of your head. And we have over the last year begun training large groups of stylists, and our goal is to train skin care professionals. So we're expanding this program to include estheticians and massage therapists, anybody that's really looking at your skin. Because quite frankly, they see your skin more than your physician does.
In a regular
way. Your stylist, if your stylist even sees you every 8 weeks or so, that's way more than your doctor's ever going to see you. And so in our training, we not only talk about the ABCDEs, the how do you look at an abnormal mole, but how do you talk to someone who may have something that looks a little funky to you in a way that's not, you have cancer, but in a way that engages them. And it's also the opportunity, because for any of these things, you need a teachable moment. And, particularly with young people and the whole issue of tanning. Tanning is one of the 15 things on our plates as parents and dealing with young people. And it's also an opportunity for us to talk with stylists and skin professionals about what are those opportunities, like the kids that are coming in for the prom, like people that say, oh, I need to go get my base tan before I go on vacation. Let's get rid of some of those myths. So it's an opportunity for us to share some of those myths about tanning with stylists, and because it's an incredible way to get the message out.
What do you say to people who come to you who has a loved one? You jump on the internet and you're scared and there's a lot of emotion around it. What do you say to people who are perhaps dealing with someone who has some kind of a skin cancer, may think they have it themselves?
Mostly we say stay off the internet. It's going to make you crazy. But
I'm still going to put your website up there.
yes, please do that. I think in general, we try to get people, if you have a concern about something, get it checked. And that's really what it's about, get it checked. And we are fortunate. We live in New England where we have some of the best dermatologists and best melanoma specialists in the country. And see somebody if you're worried about something.
Yeah, I guess don't be afraid. Go to the doctor. I mean, I forget what the statistic is, but it's some number, like 50-60% of all those lesions that somebody is worried about are found benign. They're benign, and typically they're also pointed out by a significant other or somebody, like you're saying, that is doing some sort of skin, this is engaging with the skin some way. And don't be afraid. Go. It's not that painful.
We have a video on our website, and it's called Watch Your Back. And it really is a campaign for older men who, as we know, tend to get their melanomas found later and more seriously because they don't have anybody checking their back. And for men, that's a very big, the back is a very big melanoma place, and actually having somebody taking a look at your skin at home is an important thing.
Okay, Deb and Mike, fascinating conversation. Thank you so much.
Thank you.
Thank you. Nice to be here.
That's our show. Thanks so much for joining us. And if there's someone or an organization you'd like to see featured on Hometown Talents and Treasures, email me at esternvajda@gmail.com. Remember, it can be anyone. The important thing is that they selflessly donate their talent and time to help others. See you next time.